Hi guys, it's Dr. Stacy Fuller here with Northwest Indiana Chiropractic. We're in our Valparaiso location again today, and I'm doing this video to tell you a little bit about the Webster Technique. So the Webster Technique is a special chiropractic technique used on pregnant patients to help create space in the pelvis so that a breech baby is able to turn into the proper head down position for a natural labor. The breech position can be either feet down and head up, or kind of when they're sideways, which we call a transverse position. So the ideal position for giving birth is with the baby's head down. Oftentimes, if the baby's head is not down, the OB will not deliver the baby naturally. They will have a C-section. And a lot of moms out there want to avoid a C-section. So the best way to do that, in my opinion, is to be able to go ahead and do a natural approach like the Webster Technique to open up the pelvic outlet to allow the space for the baby to move. So today I'm going to show you, my assistant Tina, who's not pregnant, a little bit about the Webster Technique so that you have good information on how that technique works. So go ahead, come over here, Tina. So first thing we're going to do is put down our pregnancy adjusting pillows, which have a nice hole in the middle so that your mama's pregnant belly fits very comfortably. So Tina's good to go ahead and lay down. So first thing we're going to do is test and see which side we think is more restricted and needs to be treated. So we're going to say that the left side is the side that's needing to be adjusted in order to open up that pelvic outlet so the baby has the proper space to move. So the adjustment is very gentle. All I'm going to do is contact her sacrum and do a couple pushes straight down. Then what we're going to do is release two specific ligaments to allow that pelvis to be in the right position. So one of them connects the sacrum, which is the bottom of the spine, to essentially the butt bone here, the ischial tuberosity. So all I'm going to do is take my thumb, tension up on that ligament until I feel it relax under my fingers. Go ahead, push up for me, Tina. We're going to lift up the table so mama's nice and comfortable, not on her back with too much pressure on that vena cava from the weight of the baby. The second ligament we're going to release is called the round ligament. This ligament attaches the uterus to the abdominal wall. So again, if it's too tight, it pulls on that uterus, which doesn't allow the baby the space to be able to flip the way that they need to. So we're going to find the belly button and the top of the hip bone. We're going to come down at an angle where those two lines meet, and we're going to just tension on that ligament straight up towards her head again. And it's going to relax. So ideally, if the baby is not head down by 36 weeks, that's a really excellent time to go ahead and start Webster care if you haven't already been utilizing chiropractic care throughout your pregnancy. This gives you a couple weeks to get the pelvis in a really good position so that the baby can flip naturally. So if you are pregnant or know someone who's pregnant and their baby is breech, this is a really excellent technique to look into to get them into that natural head down position for labor. So you can go on the Webster.com. You can look people up on Webster and find a certified practitioner in your area, or if you're in the Valpo area, please call our office at Northwest Indiana Chiropractic and come see me. Thank you.